Hello everyone. So today I'm going to talk about Parkinson's disease. Parkinson's disease. Parkinson's disease results from the degeneration of nigrostriatal dopaminergic neurons, or we can say Parkinson's disease is caused due to damage to nigrostriatal pathway. Damage to nigrostriatal pathway. Nigrostriatal pathway, it involves the neurotransmitter which is involved in this nigrostriate pathway. It is dopamine, and so the neurons are dopaminergic neurons. With as we age, there is loss of dopamine. When you are aging, there is loss of dopamine and the dopamine receptors in the basal ganglia. And so, when this happens, it can lead to this Parkinsonism because there's a loss. As you can see, normally there's no enough dopamine, and when the patient is Parkinsonism, the dopamine levels decrease, the dopamine receptors will also decrease. And certain features are seen in a patient with Parkinsonism in the movements, that is hyperkinetic and hypokinetic movements. Hyperkinetic and hypokinetic movements. So in hypokinetic movements, it involves akinesia, bradykinesia, and decreased associated movements. The akinesia, bradykinesia, and decreased associated movements, it is in hypokinetic movements. Akinesia, it refers to difficulty in initiating movements. There is difficulty in initiating the movement and decrease the spontaneous movements. Then bradykinesia. Brady means slow. So bradykinesia, it refers to slowness of movement. There is slowness of movements. Then decrease associated movements. Associated movements are like swinging of hands while walking. While walking, we are swinging our hands. Then while speaking, we show some facial expression. All these are lost in a patient with Parkinson's. And when the lack of the facial expression is called expressionless face or a mask face. Hyperkinetic movements. In hyperkinetic movements, we see rigidity, tremors, and a festinant gait. Rigidity. Rigidity, we mean to say that the flexibility of the body is lost. The flexibility is lost. Then tremors. Tremors, it refers to certain vibrating movements or like shaking or quivering movements, and this is seen at resting condition. The tremors are seen at rest. Then festinant gait. Festinant gait, it refers to the condition in which the patient is trying to walk in such a way that as if he is trying to catch the center of gravity, or the patient, he seemed to be walking in a stooping position. Patient, like all those old people, they seem to be walking in a stooping position. That is, the patient tries to bend forward, but he does not fall and takes short and shuffling steps. Typical appearance of a patient with Parkinson's disease: there is stooped posture, then there is rigidity, there is no flexibility, stooped posture, bent condition, then shuffling, short step gait, that is, the person is saying short and the shuffling step. In stooped condition, then masked facial expression, then none of the facial expressions are seen because the associated movements are not seen. Then reduced arm swimming, that is also another associated movement. Then slightly flexed hips and knees, and trembling of extremities. This is the appearance of a person with Parkinsonism or a Parkinson's disease. General treatment for a person with Parkinson's disease, because there is deficiency in DOPA, we do the treatment by giving levodopa injection. Levodopa injection. This levodopa injection, it will cross the blood-brain barrier. Levodopa injection, it will cross the blood-brain barrier, and it will support the functioning of dopaminergic neurons. Levodopa, it is an injection we give to as a treatment to Parkinson's disease, and here what happens is that the levodopa will cross the blood-brain barrier and will support the functioning of the dopaminergic neuron, which is involved in the nigrostriate pathway, and the movement is facilitated. Thank you, guys.